have with us Professor Nivesh Sewall, who is intensive care and pulmonologist, and we are joined by Dr. Bhadrashali Modi, who is family physician, and they are both live with us right now from Johannesburg in South Africa. Thank you very much, both of you gentlemen, for joining us. Over the next 30 minutes, viewers, we will try to understand the behavior of Omicron and the symptoms that we need to watch out for. Remember, the mantra here is very clear. Don't panic. But we need to be cautious. We need to know everything that's happening around. Now, let me begin this discussion with you, Dr. Modi. How did South Africa really detect Omicron? And how is the situation right now?
So in the last 2 weeks, we just suddenly noticed an increase in number of cases of COVID positive patients. It was very sudden. You know, you went from maybe 1 to a week to suddenly 3, 4 a day. And like this week, we're going to like 15, 20 a day in a practice like mine. So you could see that. So at the same time, I mean, the scientists at the lab, they detected that there's a new variant because as you can see, there's a number of tests that were conducted. And unfortunately, we managed to detect a new variant and understand why there's such a sudden rapid increase in number of cases. You know, we didn't know about this variant 2 weeks ago.
Well, absolutely, and that is the cause of concern. And Professor Sewall, now I want to understand from you, because in just 1 week, this new variant of concern, first detected in South Africa, has spread to about 30 countries. There are 2 cases in India as well. And like Dr. Modi just now mentioned, it all started with 1 or 2 cases initially, and how the number has gone up. How is the situation right now in South Africa? What are you witnessing?
Okay, thank you very much, Hina. Now, I think we should all remember that in the middle of a wave, when we talk about a wave of COVID-19 cases, we're talking about the numbers rapidly escalating. For the last 2 years, we found that all countries around the world have had cases of coronavirus, and it's always there in the background. And that's what we talk about in terms of the background infectivity rate. But when the numbers start going up, we call it a wave. Now, we are in the start, right at the beginning of our 4th wave. Now, many countries around the world have already had their 4th wave or are in the midst of their 4th wave, for example, Europe and North America. Now, it just so happens that when the numbers start escalating, we look at the number of tests we do and we see what the rate of positive tests are. So out of every 10 tests, if 1 tests positive, that's the 10% positivity rate. Now, the problem with South Africa at the moment is we've been expecting our wave and we just haven't been sure when it was going to happen. At this point, probably 2 weeks ago, the positivity rate was less than 1%. Right now, it's close to 40% in the Gauteng province, which is our major province that includes Johannesburg. So it's the most populous part of the city, our part of the country. And our positivity rate last night has hit 40%. Now, 40% is the positivity rate that we've seen at the peak of all of our waves. Of all the waves that we've had so far, 40% has been the peak. Unfortunately, what we've seen and why we're concerned right now is that it normally takes about 4 to 6 weeks to get to these numbers of what we call the peak. What we're seeing is that this positivity rate has happened just barely 10 to 12 days into this. Now, one could also argue, because the narrative that is out there is that there were patients from South Africa or Southern Africa where it was discovered, and then by then it's now spread all around the world. We don't know this. We just happen to have a system where the testing and the sequencing has been superb. And we've been managing to identify that the predominance of our strain at this moment is this new Omicron variant. And the Omicron variant has now overtaken what we've had with the Delta variant in the past. So that's our predominant variant as we speak for the last 14 days.
Okay. Important update you're giving to us, that 40% is your positivity rate right now, and it has gone up sharply in the last few days. Now, I want to understand from you about the symptoms. Before that, I want to tell our viewers, in case you have any questions about this new variant of concern, Omicron, then please call us on Mirror Now. The numbers are flashing at the bottom of your screen. Of course, our experts, these very eminent doctors, will be happy to answer all your questions and will also help you clear your doubts as as well. Now, Dr. Modi, to you first. What are the symptoms that you are seeing in the patients who are coming to you who are getting positive with Omicron variant?
And so we see a spectrum of symptoms from a very mild case to someone fairly severe. So the severe one is easy shortness of breath, but we don't see many of that. The vast majority are very mild cases, a very distinct headache, body aches and pains, a bit more distinct than the previous variants. But we've seen headaches, body aches and pains, sore throat, maybe a bit of a runny nose, and a bit of a cough. Now, these are very deceptive symptoms. You know, a lot of times people think it's just a flu, or I got wet in the rain 2 days ago and now I've got a bit of a runny nose. So because we're so suspicious, we've been testing everyone, and you just find that the number of people testing positive is increasing. Fortunately, we haven't seen that many severe cases, and there's a number of reasons why, because right now we're seeing it predominantly in the younger populations, a lot of adolescents, young adults, 20s and 30s. We haven't seen it as much in the older population as yet. Maybe there's an element of increased vaccination rate in the older population and very low vaccination rate in the younger population. But we've seen it predominantly in the younger people. And is it because they don't have comorbidities and they're young, so they're not getting very severely sick? And our hospital rate is increasing, but not as dramatically as the number of cases are increasing.
Okay.
But we have to wait and see.
So hospitalization is not really high right now. That's like a silver lining. And one thing which is important that you're telling us, Dr. Modi, that it's young who are getting affected more by this variant. So we'll discuss that and more symptoms with Professor Sewall in just a bit. We have our first viewer, in fact, joining us on the broadcast. Let's take a question from him. We have Prakash live with us from Hyderabad. Hello, Prakash. Thank you for calling us here on Mirror Now. What is it that you want to ask?
Hi, respects to both the doctors. My question is with respect to Delta. You know, Delta, we have seen a lot of mortality and the cases were very bad in terms of, sickness. People were suffering for oxygen and a lot of other, high temperatures and all we could not arrange everything in a very short time of 15 days, but it also multiplied a lot.
Yes.
I'm sure Omicron also has been more, transmissible. I just wanted to know how the patients are doing and how are the kids, particularly India, we have kids not vaccinated yet. Probably vaccination would give some kind of defense. As I see you, Dr. Modi and Dr. Sewall was telling that, relatively older patients are able to take it probably because they're vaccinated.
Yes.
But if this is the case, it is going to be, worse in India because India is a very young nation and probably we will not be able to see so much of pain. And I'm coming from that perspective. I'm sure what South Africa is going on is really unfortunate. And whatever Indians can do, we should be doing it. But my question is in the perspective of how we can, safeguard ourselves.
Yes, that's a very, very important point that you've raised, an important question that you've asked, Mr. Prakash. Appreciate you calling us here on Mirror Now. Professor Sewall, would you like to address it? Because, whatever you tell us, it's going to create a lot of awareness here. People here can be prepared in a better way. And that's our idea too.
Okay, thank you very much. I think that's a very important question to ask. And there's a lot to unbundle in that very seemingly simple question. We have to live with the coronavirus as a worldwide pandemic right now. So the issue is not the Omicron variant per se, although that's specifically what we're going to be talking about in terms of disease severity. And I think the focus that we have is incorrect at the moment. We're all, quite rightly, worried about, is this going to be more severe? Is it more transmissible? What is it going to do? There are a lot of what ifs. But the reality is that when we have spread of any of these COVID-19 variants, whether it was the Delta variant, a lot of people got very ill and with tragic consequences. So the major things that we talk about are still vaccination, and we can get to the vaccination of children and the lower age groups soon, social distancing, masks, and sanitizing, which is all we have right now. And unfortunately, what we've been seeing, and if we can use this to illustrate the point again, we're only 14 days into the surge that we've had here. And the learning point that we have right now is that in this 14 days, this disease has been driven by young people. In South Africa, we're on an education curriculum where it's the end of the high school year and it's the end of the university year. And we've actually seen, as of 3 weeks ago, that these little hotspots that we found have been around young students who basically finished at the end of school, and they're having social gatherings. So social gatherings are our major issue that we would need to avoid. And that is still coming back to what we have to do to protect ourselves. Vaccination, vaccination, vaccination. The question about boosting, we can get to as well. But the problem is, in the developing world, we're barely through our primary immunization program, let alone a boosting program. But the basic principles are to avoid contracting the disease, number one. And the only thing that you have to actually prevent the disease becoming severe is immunization, is vaccination. That is the only thing that's been shown to improve your chances of not needing the oxygen cylinder, not having and developing pneumonia and needing a ventilator. So right now, it is exactly the same as all the other waves of coronavirus everywhere else in the world.
Okay.
When the waves start, it is all social gathering based.
So, Professor Sewall, that my next question is what Mr. Prakash also mentioned. How do we protect the kids? Because children under the age of 18 years have not been vaccinated, at least not in India.
Yep. So that is the issue that I think we should be. Look, and one of the problems that I think we all talk about is, obviously here on your panel, we're doctors, we're scientists, we're not politicians. And unfortunately, I think politics and medicine tend to become very separate at some points and speak at different areas and different levels. In South Africa, we have officially started our vaccination program on the 11 to 17-year-olds, because the over 18s were already rolled out for almost 6 months now in various priorities. We have a program that is now officially up and running for the 11 to 17-year-olds, as it is in the United States. We are in the process of authorizing the 5 to 11-year-olds. And we're hoping that that happens within the next 2 months or so. And remember, it's all about logistic reasons. And if you look at countries that have supposedly tried to have done well in terms of vaccination programs, the United States hasn't done particularly well in terms of actually doing it, because their vaccine efficiency rates and uptakes hasn't been particularly great. But the authorization of childhood vaccinations from the age of 5 has proven to be safe. It's proven to be effective. And I think one of the things we need to realize is, and we're going back a little bit, remember, we're trying to make decisions and make predictions about Omicron, but we need to learn our recent lessons. And the recent lessons in the United States were that children were getting far more ill with the Delta variant than they were with Alpha and Beta. And children were ending up in intensive care units. Children were ending up on respirators, ventilators. So our major concern is that, number one, kids are going to get ill. We've always been concerned that kids get ill or they get infected and they will spread the disease to the adults and the grandparents who are immunocompromised. That has always been the concern. But I think one of the things we've tended to hope, we've closed our eyes as a worldwide community and hoped that it doesn't come true. But we had hoped that children do not get ill with this, and we just do not know.
But, you have actually told us something important, that at least in your country, people in the age group of 11 to 17, the teenagers, they have started getting vaccinated. Now you're looking to vaccinate 5 to 11-year-old kids as well, and something that India can really now also consider. I have 2 more viewers joining us. We have Mr. Matthew joining us from Bengaluru. We are also joined by Captain Jaspal from Rohtak. But first I'll go across to Matthew from Bengaluru. Yes, Mr. Matthew, what is it that you would like to ask our experts today?
Very good afternoon, Hina and the panelists. I've just got a couple of points to make, the observations being made. See, we've come to know that the first detection has been from South Africa. We should also understand that it is just that the detection has been made there. That doesn't mean that it is originated in South Africa. I'm sure that very many countries, including ours, has already gone through this, and it is very much prevalent because the two cases that came in Bengaluru, one gentleman, a doctor, he had absolutely nothing to do with his travel or anything with South Africa. So the serious concern is that we already have it in India, as much as many other countries. Now, what we can do is, as we know, we are not very clear the after effects of Omicron. I've just been hearing that some have been telling that no fatalities, but we can't take it as a thumb rule because it is hardly days that we have got the feedback. At least we have to wait for at least a month's time to really know how it mutates. So it's still a matter of concern. Therefore, I would suggest that with immediate effect, it's not just for our country. Every country has to put up this international restrictions as far as travel is concerned. That's the first thing. And second thing, in Bangalore itself, a good number of people are still not vaccinated, especially people who are being scared or very many reasons.
Yes.
So the vaccination part has to be complete. It has to go on a very strong drive. And as far as the other safety protocols that we have to endure to, like see the crowds coming to the places and all those things, we have to go strictly by it. And only in a month's time we'll be able to get some idea of how this particular virus is going to act. That's the only way forward.
Absolutely.
And if we continue with the schools and it will be very dangerous.
You're absolutely right, Mr. Matthew. I really appreciate you joining us here on Mirror Now. I'll take that question across to Dr. Modi, but I have another viewer, in fact, joining us live. We have Captain Jaspal with us from Rohtak. Good afternoon, Captain Jaspal. What is it that you would like to ask?
Good afternoon, Hannah. After a long time, you people have opened the line for us. And
Yes, sir.
It's a privilege to be on your panel. And good afternoon to these two gentlemen who are very learned. My point is, when it is so infectious and transmissible, what is its life on the newspaper? And if you read the newspaper 4 times, same paper 4 times a day, how it is going to affect everybody's life? Kindly let me know.
All right, Captain Jaspal, appreciate you joining us, and you'll get your answer as well. One more viewer, in fact, joining us, Dr. Modi, Joseph Gururaj from Hyderabad. Good afternoon. What is it that you would like to ask?
Yeah, very good afternoon to you all. So both the panelists, I have a question. Like earlier in the initial statement, they have mentioned the symptoms are almost similar, having body pain, headache, fever and all, as was the case in COVID-19. Even the symptoms are similar to Omicron.
Yes.
So now I just wanted to know whether these people who had similar symptoms are already vaccinated twice. That is first question. Second question, is there any fatality as of now?
Okay.
After the findings of Omicron, since it's been just 14 days, and how serious they are, is that been affected the lungs also, as was the case earlier time?
Okay, very good question there, Joseph Gururaj. Thank you very much for joining us here on Mirror Now and asking the question. Of course, now it's time to get the answers as well. Let's begin with Dr. Modi. The first one, of course, this is concerning many people because South Africa, let me be very clear here, has been very honest to the entire world in telling the world about the detection of this new variant, which became a variant of concern. And now the world is preparing and dealing with it by increasing the number of tests and genome sequencing. Do we know anything about it? Was it actually first found in South Africa, or what's happening in this regard?
So it was first identified in South Africa, but it doesn't mean that the variant hasn't been around the rest of the world. We're now hearing reports of at least about 22 countries across the world that have now identified the variant by going back into the cases and seeing the variant has been there at least in the last 2 weeks. So it hasn't originated in South Africa, but more South Africa seems to be the worst affected by it so far. And what we know about it is that it has 32 mutations, which is unlike the Alpha and Beta and the Delta variants. And it has almost all of the mutations that those viruses have. It's got all of that. So we've seen that it's much more infective. It spreads very easily and very rapidly. And yesterday we just heard that we see that it does, even if you had COVID previously, you're still 3 times more likely to get the Omicron variant COVID again. So previous infection doesn't protect you. And we've seen that in practice as well, that how quickly it spreads, how quickly people get sick, and also people that have been fully vaccinated are coming with COVID infection. Now, I just want to qualify that. It's not the vaccines are not working. Proportionally, 80% of people, 90% of people that we're diagnosing are still unvaccinated. But there's a small portion of people that have been fully vaccinated and getting COVID. And also clinically in practice, what we see is that the people with COVID and has been previously vaccinated are not as ill as those that have not been vaccinated. You can clearly see it in the symptoms and in how they present. So those are the 2 factors that we know. We also in practice, and this is early days, it's only 14 days in our current wave. So unlike the Delta where people's oxygen saturation just dropped and there was oxygen hunger, we haven't seen as yet that level.
Okay.
Whether it's coming, we don't know. But so far, we haven't seen it in that level, so we shouldn't be panicking.
Very, very important information. As of now, you've not seen the kind of desperation that we saw among the patients during the second wave in India, specifically shortage of oxygen, etc., that was being reported. That is not being seen so far. Professor Sewall, now, another question was important that how are the symptoms really different from what we saw in the cases of Delta variant?
Yeah, all right. So at the moment, remember, when you have any of these illnesses, whether you have actual influenza or flu, whether you have coronavirus, or whether you have any of the other viral illnesses, a lot of the initial symptoms are going to be the same. You're going to have fevers, sometimes very high fevers, body aches, body pains, maybe a stuffy nose, maybe a slight cough from the upper airways, but that is the initial symptomatology of most viral infections. And that's exactly what we're seeing right now. Now, one could ask whether they're slightly more severe, whether we're seeing them more prevalent or being more profound. I suspect they are, but remember, we don't want to make huge distinctions right now, just 14 days into a pandemic. And I'll tell you now about the numbers and why we have to be a little bit more responsible about all the predictions that we make with grand gestures, because our numbers are fairly small at the moment, even now that we're in a wave. Patients who get ill thereafter, so at day 1 to day 5 to day 6, you will have these symptoms of a viremia or a virus in the bloodstream. And those are the high fevers, the body aches, and generally feeling terrible. Patients who run into trouble and end up in hospital thereafter are usually from day 10 there onwards, day 10 to 12 to 14. In the Delta variant, we saw it up to day 18, 21. So that means 2 weeks after the time, that's when the body's organs started running into trouble. That's when you got pneumonia. And pneumonia is not the same as just having a runny nose. And it's not the same as the body aches and pains at the beginning. Pneumonia is when the oxygen levels start to drop. Kidney failure, heart failure, those are the things that we worry about, specifically in people who are older and have issues with heart and lungs and kidneys to start with. Okay. So those patients ended up in the intensive care only ended up dramatically ill. And all those pictures that were seen on news organizations all over the world about people lying in corridors in hospitals running out of oxygen, that process is when you have multiple organ failure or multi-organ failure or cytokine storm, whichever you want to call that terminology. That process is only about 14 days to 3 weeks down the line. And I fear that we still have that to come. And we shouldn't be making grand judgments on this is just a mild disease now, because we really do not know. And to answer just a touch on a little bit of the other question is where this was, we've identified this in Southern Africa. And in fact, the first 4 cases that were identified actually were from Botswana, which is a neighboring country. And we believe that those 4 patients who actually tested were tourists from Europe, actually, rather than local residents. Remember, when we identified this in South Africa, we were averaging 200 cases a day. That's 200. That's all it was. Our positivity rate was less than 1%. So this was routine screening and routine surveillance, which is what the scientific community has been superb about. And in fact, we've got fantastic gene sequences who have been slaving away, even when the numbers were low, to actually make sure that we have this information. And this is something that should have been happening from the global scientific community in terms of informing all of us as to what is available and what is a variant of concern. Remember, the only reason to do this, it doesn't help you except to inform our decisions going forward. So when we talk about variants of concern, what that means is they are looking at lots of variants, many, many, many variants. Some of them are not particularly concerning because we don't think they're going to be more transmissible or more dangerous. If you rewind 6 to 8 months ago, Delta was a variant of concern. We didn't know much about it. Now we do know that it is more transmissible and it does cause more disease and more death and more severe illness. So we just do not know at this point. But to answer that question and take it further, we shouldn't just be complacent about it and forget about it and then say, okay, in 6 months' time, we'll know when lots of people have had pneumonia and passed away. So that's why the variants of concern are important, so that it informs our decision-making going forward. And that does not mean closing every border, because as we've seen, about 4 days before our first variant was reported, they've now found that there was a case in the Netherlands that also wasn't related to travel to South Africa immediately. And the concern is that a lot of the variants that patients that have been suddenly popping up, Belgium, Israel, for example, had no contact with people from South Africa, no travel to Southern Africa, and in fact were sporadic. Now that is a very major concern to us, which means that this variant is already in places around the world. We just have not looked hard enough for it.
So Professor Sewall, sorry to interrupt you there. If I've understood you correctly, then you're saying that among the first few cases that were first identified, there in South Africa, 2 of them were actually tourists who had come from Europe. So it's possible that it could actually have emerged in somewhere, some part of Europe, because Europe was already seeing a spike in COVID cases and maybe proper genome sequencing is not happening and maybe it was not identified there. And when you did genome sequencing in South Africa and Botswana, that's when you figured out that this is different.
Well, those are the facts as they are. Remember, what we don't want to do is go and cross the borderline and cross the boundary line of conspiracy theory. I mean, we're still all having conspiracy theory of what happened in Wuhan over 2 years ago. So what we can say as fact is that when we've had 200 cases per day nationally, and we were doing random surveillance, we picked up the first 4 cases and they included tourists. Now, one could also ask if there were, on average, the average European country like Germany and the UK was running at 40,000 cases a day. One has to ask the question as to where did it originate? And I think the only way of knowing that is to make sure that we've had gene sequencing done retrospectively if they can.
Right.
And that's something that they're also noticing in Europe. That patient in the Netherlands, as we say, that sample was taken well before the first one was identified, in inverted commas, in South Africa.
Right.
So does that mean that this originated in the Netherlands? The answer is no. We shouldn't suddenly close the borders to the Netherlands because, that's potentially something that's happened there. And I think the focus has been lost, in that sort of way. Because really, if one wants to talk about where was the first case actually found, well, that probably would be the Netherlands now.
Okay, important point there. Professor Sewall, stay on with us. Dr. Modi, we have 2 more viewers joining us on the broadcast. We have Prasad Krishna from Chennai. Good afternoon, Prasad Krishna. What is it that you would like to ask?
Good afternoon, ma'am. You see, especially during the second wave, when the most important thing we found is that the spread of the virus is so virulent and people have graduated into even intensive care treatment, etc., within a very few days. And later, they had many people lost their lives also. When we say Omicron is also that virulent, Are we supposed to feel that this Omicron is so dangerous? Number one.
Okay.
Number two, what are the estimated fatalities of this? Because the second wave really brought our lives to roads only because of the fatalities, and whether Omicron is also capable of it.
Okay. Fatality is very important. How dangerous is it? I would like Dr. Modi to respond to that. But let's take another viewer's question as well. We have Asha joining us from Mumbai. Asha, good afternoon. What is it that you would like to ask?
I'm talking on behalf of all of us as citizens here and internationally. We are separated by our age, by our comorbidities. We are also separated by the energy that we have to create antibodies. So when you're run down or a child is very malnourished, how do you expect vaccines to help that person create antibodies? Because you're already so run down. You're completely half your age. You're frail. And then when you have all these new, swords that are hanging over our heads, you're putting us on masks where we are breathing back our own CO2. Where is it that you have helped? Where is research going? Why aren't you looking at each of us separately? You vaccine the old people in the houses who are alone. Who looks after them after what happens? And I think South Africa has done a fantastic job with aid, and they have got help from all over the world. We have to learn that every nationality, every nation, the genes are different. You cannot carry the same treatment in different genes. You can't poke vaccine needles into little arms of 2-year-olds. This is wrong. I have been suggesting to CIPLA for 2 years that come out with a nasal vaccine. Please come out with, because it is a pulmonary problem. And then COVID leaves you completely dead. I know of people who've taken vaccines who dying after that. You know about it.
Yes.
Mr. Powell died. So I think research just saying emergency, this thing. AstraZeneca is talking of, cough. I'm taking blood thinner. I've got a heart problem, and I'm already 78. And you're going to inject me and booster dose it every year? No, sorry. This is not the way to handle us.
Miss Asha,
you have to look at us.
We have to look after the elderlies. That's a very, very important point, ma'am, that you're making. And I really appreciate you calling us here on Times Now. Do call us regularly because, this kind of a feedback is what we really need. And, for the world to defeat COVID, the entire world has to come together. Even if one country succeeds, we will not be able to defeat COVID. So the world really needs to be together. So I'll get this question answered from my guests as well. But Dr. Modi, first I will like you to talk to us about fatalities because people are now worried. How dangerous is it? Have you heard of any fatality because of this new variant?
So we're still early in our current wave, it's only 14 days. And as Prof. Sewall was mentioning, that, we only start seeing hospitalizations start going up from day 10 to 14 days. And then deaths will only increase maybe 2 weeks later. So it's very difficult to comment, to say definitely there's an increase in fatality rate or there's a decrease. What we are seeing at the moment is that it's mirroring, the hospitalization is mirroring exactly the Delta wave. We haven't seen an increase or decrease. And the patients so far, they've been fairly okay, but it's too early to say that definitely we're going to see, because this variant is more infectious, it will cause more deaths. It doesn't work exactly that. There's still too many unanswered questions, And the best way is to be vaccinated. As you said, if for everybody to save, no one is safe unless everybody is safe, And until everybody is vaccinated, you're going to have these variants keep coming out, and we're going to keep having these waves attacking us. So right now with the Omicron, it is too early to say whether we're going to see an increased fatality rate or not.
Okay.
But we've seen, so far, we're keeping our fingers crossed. So far, we haven't seen an uptick in hospitalization and deaths rate.
Okay.
But it's a matter of time.
Okay.
It's only 2 weeks now.
Well, absolutely. Professor Sewall, now another question that Ms. Asha from Mumbai had asked. Would you like to address her concerns? Because elderly people are clearly worried right now. And where are we as far as the development of a probable nasal vaccine is concerned? Anything that you can share?
I think the idea is that we need to hear what her concerns are. Because what we're finding across the world is that there are high numbers of vaccine hesitancy. And remember, I blame all of us, and I think we should all take the blame collectively as scientists, as doctors, government leaders, because our messaging has been incorrect. And I know this for a fact. And I'm a practicing doctor, and I see patients every day, not just in the intensive care unit, but I do see patients and have these discussions. And I think what we need to realize about vaccines are this. All of us have an immune system that works in one way or the other. And when you're elderly or whether you have an immune disease, or we speak about these comorbidities, it means that your ability to provide ammunition to fight this virus is reduced. So if you're young and you're fit and you're healthy, you can produce antibodies. And we talk about this as the so-called immune system, but it's a hugely complex system. But we're able to provide ammunition to fight this virus. Now, if you're older and you have a boost in terms of you have a reserve of some ammunition that can help to fight this virus, there is a better chance that your body will fight back against this virus and the disease that it causes. Now, it does not mean it's going to be 100% effective, because no vaccine is 100% effective. All it's doing is that it's increasing the chances that the body can fight back and protect one. So when we talk about why are vaccines important, you'll hear people talking about, well, it doesn't mean that you're not going to get ill. It will just reduce the risk of you passing away or dying or getting into intensive care or having severe illness. So we're using it to try and prevent those horrible pictures that we've all seen on TV from around the world, where people are gasping for air and not being able to breathe, and it becomes a pulmonary problem. And just to point out, it's not only a lung issue, this is a whole body issue. There are numbers of patients who die of other organs that also fail. That's why it's not just lung failure, and oxygen is not the only treatment for this. Now, that is why vaccines are important. The same way we vaccinate a child for measles, not once, but at least on 3 occasions. And we give booster vaccines for measles, not because we're worried that the child may have a rash that is itchy or may burn a little bit, but because measles in its severe form can cause things like brain damage and encephalitis.
Right.
So the reason we vaccinate children for measles is not that it prevents them from getting it, it prevents the severe disease. And that's what we need to have as a concept of what vaccination is all about. It's not a magic bullet that says, if you're vaccinated, you're not going to contract the disease. In fact, that's incorrect. It also doesn't mean that if you get vaccinated, you can't spread the disease. That's also incorrect, because that's what we've been seeing right now. I'm getting lots of these social gatherings that people have said, but the kids were vaccinated. Well, the 18 or 19-year-olds were vaccinated. So where should we go with that? And that's basically what we're looking at this point.
Right. And I have another question, Dr. Modi, and I want to ask you specifically about one more aspect of the symptoms, because during the second wave here in India specifically, we saw that how loss of smell, loss of taste was one prominent feature that we all were looking forward to, apart from other symptoms. Is that being reported in the patients who are coming, with Omicron variant?
Strangely enough, we were having a discussion on this among us clinicians, and there's very few patients that's coming and complaining of loss of smell for this variant. Now, is it this specific for this variant, or this specific type of patients that we're seeing? It's still a bit too early to tell, but definitely we're not seeing as many people with loss of smell. And that's why one of the symptoms, I did not mention it earlier, is that you can't go by that symptoms, But the Delta wave, yes, you could almost predict to say, if you've got a loss of smell, you most likely have the Delta infection. But with the Omicron, no, not yet. It seems more the flu-like symptoms of sore throat, headache, body aches and pains, and a bit of a runny nose, maybe a bit of a cough. But those are the predominant symptoms that we're seeing. And lots of body aches and pains. People describe it as I've been hit by a truck, and that kind of pains. And it's also a very sudden onset. So people can almost tell you everything started this morning, or everything started so and so time at night. It's like a sudden onset where you just don't feel okay, and you can actually see that I was fine 2-3 hours ago,
Right.
and now I'm sick.
All right. All right, Dr. Modi and Professor Sewall, I appreciate both of you for taking out time for helping our viewers understand what are the symptoms to watch out for, how the behavior is of this new variant of concern, Omicron. Thank you very much, both of you, gentlemen.